And now I want to introduce Dr. Angelina Farella. Good afternoon. It's my pleasure and my honor to be among these great physicians and these supporters here today. My name is Dr. Angie Farella. I am a pediatrician in Webster, Texas. I stepped up to the plate during COVID when our large hospital systems shut down their outpatient treatment. This was not a territory I wanted even to even go into, but someone had to do it. And because of me stepping forward and taking care of patients, I have treated successfully over 1,000 patients with COVID. Most of them were adults. The children were really mainly unaffected, and which is a fantastic thing. We knew this from Chinese reports before the COVID was widespread here in the United States. This was something I came out joyfully telling people because I wanted to try to keep the children in an atmosphere of positivity and not secluding them, not shaming them, not psychologically damaging them, having them wear masks to muzzle them, having their education stopped, halted, or actually even reversed. Some of our children that have the most precious problems of, autism or hearing disabilities or visual impairments, those children are now 3 years behind where they should be, and that is unbelievable. And now we have the CDC, who are not a bunch of developmental pediatricians, moving the goalposts of development to make it more normal for them to be behind. This is a travesty. This is not the United States of America. This is not the medical realm that I went into 25 years ago. We need to protect our kids. Our kids are being damaged every day by a very dangerous and expired medical treatment known as the COVID-19 vaccine. These children not only not need the vaccine, but it is causing damage to their precious hearts, their immune system, and never mind that it's normalizing strokes and cardiac defects. This is not acceptable in the United States of America. The Food and Drug Administration is negligent in their duties, in my opinion. Children should never be used as lab rats against their will, nor should the courts intervene in a parental matter when there is a decision to be made between parents that may be divorced. There is no harm in waiting. There's absolutely no harm in waiting when the children have 99.997% survivability from COVID-19. This vaccine is expired. It no longer works. It is not efficacious. The definition of vaccine is that it should be at least 50% efficacy in 1 year. It is no longer for prevention of disease or to decrease transmission of disease. It is now a medical treatment. The FDA is also derelict, as well as the CDC, in not recognizing the VAERS reports, Adverse Event Reporting System. And I don't have to tell most of you this, but if you go to openvaers.com, you'll be shocked and appalled at how harmful this medical treatment is currently affecting American citizens and other citizens around the world. This needs to stop. They need to step up to the plate and protect the American people, especially the children. We have no long-term studies. Heck, we don't even have short-term studies. We don't have any studies on the efficacy of this except to tell you it's definitely not 50% efficacious for a year. Right then and there, it should be stopped. I just praise everyone behind me who has had the guts and the fortitude to step forward for patient safety and for patient treatment. I applaud all of you. It makes me so proud to be among you. Thank you.
Thank you, Dr. Farella. Now we're going to hear from Dr. Richard Urso.